we know that epilepsy impacts our physical health. We see that all the time, but what we really need to focus on, as well as keeping our children physically safe, is also the mental health effects and the social consequences of epilepsy and what that looks like for our families. So why is it that we need to discuss this? We know that epilepsy has devastating social and psychosocial effects. And if we don't address those ahead of time and be proactive with it, we can really notice a decrease in our patients' mental health. So our objectives for today are to gain a better understanding of how epilepsy truly impacts our children and their families, identify the mental health comorbidities, and really describe the importance of how our schools can get involved and how us as parents can have that advocacy role for our children on the school campus. So what are some of the social consequences of epilepsy? What does it look like for our children and on the school campus and, even in their homes and in our communities? We know that epilepsy affects the overall quality of life in patients and their families. We know that they struggle with emotional, behavioral, and relationship difficulties. And then we know that epilepsy constitutes a huge, significant burden to the children and their families, which really indicates our need to be proactive in our mental health services that we're providing for these children. So what are some of the psychosocial impairments that we notice either in a clinical setting or that you may see on a school campus or even in the home? With a lot of our epilepsy, children with epilepsy, we notice persistent worrying about their seizure disorder. We know overall that our children with epilepsy have a poorer self-concept and a lower self-esteem than children with other serious chronic medical conditions. We know that they also struggle with a lower social competence at school, so that's peer-to-peer interaction, and that they struggle with our perceived stigmas that we see. There was a study that was done that showed that 24% of people thought that having a child with epilepsy in the classroom would actually be disruptive to their other children's learning needs. And so there's this stigma that surrounds epilepsy and has for a really long time. And we'll go over a little bit more specifically what that may look like for our kids so that we know how to better interact and create an atmosphere and an environment that's going to be one of safety for them. Another thing to kind of look at is that in another study that we talked about, more than half of the children in a particular study asked and wanted help in handling their seizures at school, talking to other people, talking to their teachers, talking to other students. They really wanted to focus on asking for that help. And then another big piece to look at is in our adolescent population, right? When we're looking at our adolescent population in terms of their developmental abilities at that particular time age, we're looking at them wanting to be independent, their driving, their ability to hang out with friends on their own, all of that. And a lot of times with our adolescents who have epilepsy, we unfortunately have to take away a sense and a loss of that control. We have to take some of that control back because sometimes we're telling them, you can't drive, or we really need to make sure that we're watching you a little more carefully, whether you're with your friends or sports you're playing and that sort of thing. So we want to make sure that we're recognizing how epilepsy really impacts our children and our adolescents in their appropriate developmental stage. We know that our kiddos with epilepsy oftentimes, unfortunately, have difficulty time making new friends. And a lot of that, I think, is due to the reason that our kids naturally with epilepsy most of the time will socially isolate, right? Because they feel different from their friends. They feel like, and they know something's different. And a lot of times it has to do with the anxiety and the fear that they may have seizures on a school campus or even out in the public. And that just is a natural tendency for them to want to kind of close in and not really be out there and involved with everyone. And because of that and a lot of other things, our kiddos do experience bullying and teasing from their peers on a school campus. So it's really important to make sure that we're addressing those needs pretty early on in a treatment setting. So moving on to kind of stigma and epilepsy. And we know that epilepsy is one of the world's oldest recognized condition. And what's interesting is that it's been dated back to 4000 BC, at least written record-wise. But we just didn't know what it was called at the time, right? There were a lot of different misnomers, a lot of different stigmas, and a lot of different things that epilepsy was around. They just called it something else, right? And unfortunately, that stigma still surrounds epilepsy today, through the fear of other people and not knowing, through misunderstanding, through discrimination. As our kids move into adulthood, some things kind of change in their job situation or maybe even on the school campus. And so we want to make sure that this bullying, this discrimination, misunderstanding, and this fear is really going to be a part of our conversation with everybody around us, because the more that we know about epilepsy, the more our children are going to have this source of empowerment on a school campus. And we do know, working in a clinical setting, that parents often withhold the medical diagnosis from the school personnel because they're fearful of their child being judged, and they don't want their kiddo to be treated any differently than anyone else. So it's really important to encourage parents, encourage the children themselves to advocate for themselves and really talk about the condition that is affecting them, not only physically, but in an emotional and a social way as well. Sometimes patients experience with epilepsy, these are a couple key things that we hear on a frequent basis and in studies. This is what they experience with epilepsy. This is how they feel. They're fearful of deterioration. They're fearful things are going to get worse. Our adolescents are fearful of having to depend on other people. And as our kiddos get older and they move into the adult population, depending on other people, right? Not maybe being able to live on their own. And some of those things that with our independence that we work on building in our children as they get older, some of those, sometimes unfortunately, we have to kind of go backwards with them and really help them build on what our expectations are and making sure that they're going to be safe wherever they're going to be. Desperation and insecurity, they feel like they've lost a sense of power, shame, right? They feel bad about kind of what's going on and how epilepsy affects them. And then really just feeling different that there's something that they don't have control over, and that this is something that truly affects them and affects them with their interaction with their peers, with their family, and with the social environment outside their home. So for a long time, really when we were working with patients, physicians, patients, and everybody really focused solely on controlling the epilepsy physically wise, right? We're giving you medication, we're trying to make sure that everything's under control and that you're going to be safe. But really in recent years, we've tried to be more proactive in a sense of being able to provide early identification of some of the major comorbidities that our kiddos and adolescents and young adults face when they've been diagnosed with epilepsy. One of them is depression. And we know that depression is very, very frequently under-recognized and under-treated in children who have epilepsy, up to 30%. And I'm going to say that some of these stats in the presentation are a lot lower than they probably are because these studies are very old. There aren't a lot of new updated studies that are going to promote kind of more mental health and epilepsy. I think there should be. But I'm just going to say with a grain of salt, the percentage-wise, if I had to guess, is going to be a lot higher than what I'm presenting to you. So up to 30% of children and adolescents who've been diagnosed with seizures also have depression as a comorbidity, which means they also have depression along with their epilepsy diagnosis. And then those that have the depression, there's about 63% of children who also had an anxiety disorder. So we're looking at anxiety and depression as two kind of the biggest components of what our children with epilepsy are going to be facing with their epilepsy diagnosis. We know that there's a higher rate of suicide found in children and adolescents with epilepsy than that's found in the general pediatric population. And kiddos with epilepsy are at risk for depression, anxiety, social isolation, bullying, and suicide. And then among deaths related to epilepsy, suicide is rated as one of the top causes of death. So that's even more of a reason to make sure that we're being proactive with recognizing some of these signs and symptoms, which we'll go over next, of really how to address talking to our kids and getting them help early on. So the next slide I've added in here, a very simple, easy to read characteristics of what you may see in children and adolescents who are experiencing signs of depression. I always like to tell people depression doesn't always show up in the way we think it should, or the way that we see in movies, or maybe we've experienced ourselves, right? Not everyone is going to be crying and crying all the time and not really able to express kind of their emotions. Sometimes what we see is more irritability, more anger, right? More sensitivity to rejection. We've got the social isolation here. We've got a loss of interest in activities. Our eating may change, right? Our behavior might change in a sense that they don't really care about anything anymore. They're going to be more reckless in things that they're doing. Any alcohol and drug use with our older kiddos. And self-esteem. We already have a lower sense of self-esteem in children with epilepsy. And so some of these thoughts may be a little more increased or intense with our kiddos who have seizures. So inappropriate guilt, feelings of not being loved, hard time concentrating, which comes along with epilepsy most of the time anyway. So sometimes it's hard to tease these out, but really what I'm going to say is just pay attention and be proactive in a conversation with your kids as they get older in an appropriate way, and make sure that their sense of self is being taken care of just as much as their epilepsy in a physical sense.